Let's see an NCLEX RN video based on care for patients with hematological disorders. When we are talking about hematological disorders, it includes RBC disorders, bleeding disorders, WBC disorders, and lymph disorders. RBC disorders include iron deficiency anemia, vitamin B12 deficiency anemia, folic acid deficiency anemia, sickle cell disease, aplastic anemia, G6PD deficiency. Then if you talk about bleeding disorders, you need to think about thrombocytopenia. WBC disorders includes leukemia, and lymph disorders include lymphomas and multiple myeloma. Before going to this video, we need to know about the normal values of the blood cells. RBC for males it is 4.21 to 5.81 million per millimeter cube. For females it is 3.61 to 5.11 million per millimeter cube. The hemoglobin value in adults, that is we are taking the age group 15 to 64 years. For males it is 14 to 17.3 gram per deciliter. For females, it is 11.7 to 15.5 grams per deciliter. The hematocrit value in males, it is 52% from 42. And for females, it is 36 to 48%. If you see the WBC count total, it is either can be written as 4,500 to 11,000 cells per millimeter cube. It is same like 4.5 to 11.1 into 10 raised to 3. It is raised to 3 cells per millimeter cube. The neutrophil, eosinophil, basophil, lymphocytes and monocytes, they can be counted as cells per microliter or as percentage also. Neutrophil, the count is 3000 to 7000 cells per microliter, or you can just tell 59%. Eosinophils, 100 to 400 cells per microliter, or 2.7% you can tell. Basophils 20 to 50 cells per microliter, that is 0.5%. Lymphocyte 1500 to 3000 cells per microliter, that is 34%. Monocytes 100 to 700 cells per microliter, we can tell as 4%. And the platelet count is 1,50,000 to 4,50,000 per millimeter cube. A 72-year-old patient presents with complaints of fatigue, dyspnea on exertion and numbness in her fingers and toes. The nurse correlates these findings to which condition? Thrombocytopenia, thrombocytosis, vitamin B12 deficiency, iron deficiency anemia. So here the patient is complaining of fatigue, dyspnea on exertion and numbness in her fingers and toes. These are the symptoms of anemia. But if you see the shortness of breath, fatigue, dizziness, there are also some neurological manifestations which are present here, like numbness in the fingers and toes. So that is a deficiency of vitamin B12. Peripheral neuropathy, confusion, depression, impaired taste, impaired equilibrium, visual disturbances. These are the signs and symptoms which are shown by patients when they are having vitamin B12 deficiency, along with fatigue, shortness of breath, dizziness. The nurse caring for a patient receiving chemotherapy receives a laboratory result of WBC 1.1 into 10 raised to 3 millimeter cube. What is the primary goal for the nurse? Protect the patient from infection, institute isolation precautions, have the patient wear a face mask, restrict the number of visitors the patient receives. So here the patient is receiving chemotherapy, and if you see the WBC value, it is lowered. So here when the WBC is lowered, the patient need to be protected from infection. There is no need to isolate the patient, just standard precautions are enough, and there is no need for the patient to wear a face mask, and we there is no need to restrict the visitors. We can just provide them with a face mask or ask them to use a hand washing very thoroughly, and also not to get so close to the patient's proximity. The nurse teaches a patient with polycythemia to immediately report which clinical manifestation to his or her healthcare provider. Select all that apply. Temperature 100.4 degree Fahrenheit, shortness of breath, headache, fatigue and pruritus. So the patient has got polycythemia. Polycythemia patients are at increased risk of death secondary to cerebrovascular accident, myocardial infarction, pulmonary embolism or hemorrhage due to hyperviscosity of the blood. So here we need to see for shortness of breath and headache. Shortness of breath can be indicating the patient might be going for a myocardial infarction or pulmonary embolism. Headache can be a symptom which shows the patient may be going for a cerebrovascular accident. Fatigue and pruritus also we can see in patients with polycythemia, but here the question is asking immediately to report. So these two things are not needed. The patient with epilepsy is being started on phenytoin. Which blood test does this nurse understand must be checked before administering the dilantin? Dilantin level, folate level, serum ferritin level, cobalamin level. So folic acid supplementation may increase the metabolism of this dilantin. The hepatic metabolism especially will be increased with folic acid supplementation. It is advisable to correct the folic acid deficiency before initiating phenytoin. If we are giving this folic acid as a supplement after the patient is on phenytoin, it may increase the likelihood of seizures. So before you need to check and before you need to correct the folic acid deficiency. The nurse recognizes that the administration of cryoprecipitate is indicated in the treatment of which disorder? Thrombocytosis, iron deficiency anemia, Hodgkin's disease, disseminated intravascular coagulation. So in disseminated intravascular coagulation, we will be giving cryoprecipitate which provides factor 8. Which patient is at greatest risk for developing iron deficiency anemia? A 6-year-old African American boy with no health problems, a 15-year-old African American pregnant female, a 52-year-old Mexican American female with hypertension, a 72-year-old Caucasian male with cardiac disease. So if you see the patient, iron deficiency anemia is seen, it is mostly associated with females, and also during pregnancy there can be a deficiency, and if the patient is African American, more chances, and the age also, if you are seeing, there is a greater risk of developing iron deficiency anemia. When a patient with vitamin B12 deficiency is counseled about diet, which statement by the patient indicates understanding of the cause of anemia? I know I need to eat more fruits and vegetables. I have cut out all fried foods in my diet. I have been eating more organic foods. I have been having beef or fish at least once a day. So here, vitamin B12 deficiency. So diet for vitamin B12. B12 can be found only in animal protein. So if the patient is consuming fish, beef, etc., then that is good for the patient. All others are healthy diet, but that doesn't contain vitamin B12. The nurse understands that it is essential for the patient to have which blood test before initiating folic acid supplementation? Vitamin B12 level, pregnancy test, CBC, liver enzyme. If the patient has a vitamin B12 deficiency anemia and has started on folic acid supplementation Anemia might resolve, but the neurological deterioration from vitamin B12 deficiency will continue and it may be irreversible. So, before starting this folic acid supplementation, we should check for the vitamin B12 level also of the patient. Which activity should be avoided in a patient with sickle cell anemia? Driving to the beach 3 hours away, going to a concert, running in 5K race, carpentry work. So sickle cell disease patient, they must avoid dehydration and must take adequate rest periods to prevent sickle cell crisis. So here if the patient is going to run a marathon, that is a problem for the patient. Which factor places the patient at a higher risk for developing secondary polycythemia? Type 2 diabetes mellitus, history of alcohol abuse, smoking, hypertension. Long-term smoking causes a state of hypoxia. This may cause body to increase the production of RBC in order to compensate this hypoxia. So, if the patient is a smoker, that can lead to secondary polycythemia. Which nursing action is indicated for the patient with thrombocytopenia? Avoid IM injections, encourage the patient to drink plenty of fluids, place the patient on isolation precautions, encourage frequent rest periods. So the patient is having thrombocytopenia. They has a decreased number of platelets. So clotting time will be longer for the patient. If we are giving IM injection, that can cause bleeding in the deep muscle tissue. So for a thrombocytopenic patient, you need to avoid intramuscular injections. The nurse correlates which diagnostic result as increasing the risk for infection in a patient with leukemia. WBC 11,000 per millimeter cube, absolute neutrophil counts 500 millimeter cube, hemoglobin 8.6 gram per deciliter, platelet 1,12,000 millimeter cube. So here if you are seeing all the blood values, you can see a little bit of abnormality. But here you are being asked the patient at increased risk of infection. Here the WBC count is normal. It is in the range of 4,500 to 11,000 cells per millimeter cube. But if you are seeing the absolute neutrophil count, it is less. So there is not enough neutrophils or mature infection fighting cells. So there is a chance of infection. The patient with lymphoma is beginning the induction chemotherapy regimen. Which information is most essential for the nurse to include in the treatment plan? Advanced directives, bleeding precautions, importance of frequent rest periods, neutropenic precautions. So here the patient is on chemotherapy. So neutropenic precautions is the most important. Patient may become neutropenic secondary to chemotherapy. And sepsis and death can occur rapidly in a patient with neutropenia. I would like to add one more point. Neutropenia means the number of neutrophils or the infection fighting cells are reduced, and thrombocytopenia means there is a reduction in the number of platelets. And all other things are also important, but neutropenic precautions is the major one. So here a patient is 62-year-old male who presents with complaints of fatigue, weakness and shortness of breath on climbing stairs, and also notice some bleeding gums when he brushes his teeth, but otherwise is in good health. He has a history of smoking 1/2 to 1 pack of cigarettes daily for 40 plus years and has no history of substance abuse. He works in oil refinery. Vital signs are temperature 98.6, pulse 102, respiration 18, BP 150 by 92. Oxygen saturation is 93% in room air. Lungs are clear bilaterally, heart rate is regular, bowel sounds are present. Chest X-ray shows some signs of COPD but no infiltrate. CBC result shows RBC is 3.2 million cells per millimeter cube. Hemoglobin is 9.4 gram per deciliter. Hematocrit is 28.1%. WBC 6.2 into 10 raised to 3 millimeter cube. Platelets 97,000 millimeter cube. Chemistry panel results are with normal range, as are the different serum levels and urinary. This MMA is methyl malonic acid, and this urinary methyl malonic acid, the amount will be large if you have a decrease in the amount of vitamin B12. So here there is no problem with that. The provider refers this patient to an oncologist and has been ordered a bone marrow biopsy, a PET scan and genetic testing. Bone marrow biopsy shows the diagnosis of acute myelogenous leukemia AML. A repeated CBC is done and shows hemoglobin 9.1 gram per deciliter, hematocrit 27.9, WBC 9.8 into 10 raised to 3 per millimeter cube and platelets 72,000 per millimeter cube, and an absolute neutrophil count is 3.1 per millimeter cube. Oncologist recommends to start chemotherapy treatment with a regimen of daunorubicin and Ara-C. 2 weeks after induction of the chemotherapy, CBC again is checked and some variations are noticed. He is given transfusions of packed RBC, platelet and an injection of filgrastim, a granulocytocolony stimulating factor, and is started prophylactically on moxifloxacin, acyclovir and diflucan. Supportive care is repeated as indicated by the CBC results. And 6 months after this induction of chemotherapy, the patient achieves a remission and it is confirmed by bone marrow biopsy. So here the patient is having a hematological condition, acute myelogenous leukemia, and when the bone marrow biopsy was done, it was confirmed and the CBC shows some variations in the blood values. Patient started with chemotherapy and the patient came to a remission stage. When a history of Mr. Owen is completed, which factor does the nurse determine is the highest risk for leukemia? Age, gender, worked in an oil refinery, smoker. So, here the patient was working in the oil refinery. In oil refinery, there is an exposure to benzene products. Long exposure to the benzene products makes the patient at risk for leukemia. Which CBC result correlate with the diagnosis of leukemia for Mr. Owen? RBC value, WBC count, hematocrit, platelet. So, increased production of WBC, it will crowd the bone marrow, making the production of RBC and platelet decreased. So here the RBC is reduced and the platelets also reduced, but the main reason is because the WBC count. Leukemia, even though this WBC count, you can see there is an increase, but these are immature WBCs. So that shows there is leukemia. After Mr. Owen starts chemotherapy treatment, his laboratory results are hemoglobin 7.9 gram per deciliter, hematocrit 23.8%, WBC 5.5 into 10 raised to 3 millimeter cube, absolute neutrophil count 0.6 per millimeter cube and platelet 19,000 per millimeter cube. Which potential complication is the nurse's first priority? So you can see the abnormalities in all the blood cells. Is it an anemia, leukocytosis, thrombocytopenia, infection? More chances of infection is there because absolute neutrophil count is very low. This is the potential complication where first priority to be given. Which statement by Mr. Owen informs the nurse he needs more education about bleeding precautions regarding his thrombocytopenia? I need to buy an electric razor to use for shaving. I have an appointment with the dentist to get my teeth cleaned. I guess I have to stop walking around barefoot. My wife has been after me to clean up my clutter in the family room. I guess I better do that. So here bleeding precautions are there for thrombocytopenia because the platelet count is low. And if you see this, you need to know that when the platelet count is low, there are more chances of gum bleeding. So that needs to be corrected before going for a dentist. Mr. Owen should notify medical professional or go to the emergency department immediately if he experiences which of the following clinical manifestations. Select all that apply. Temperature 102, chills, nosebleed that lasts more than 10 minutes, diarrhea 3 episodes in 24 hours, facial flushing. So here temperature 102 °F and chills. These are two signs of infection. Patient need to go for emergency department. And also the third one, nosebleed that lasts more than 10 minutes. That is also an emergency because that is because of thrombocytopenia. And if the patient is having diarrhea of more than 3 episodes in 1 hour, then that needs to be reported because that is because of an infectious process, or it can be an infectious diarrhea. But here 3 episodes in 24 hours, it can be just a complication of our chemotherapy medication, so no need to go for an emergency, it can be normal. And facial flushing, it is associated with polycythemia, that is increased RBC, so that is not an emergency, it is also normal for that particular patient. Hope you understood. Thank you so much.